Coming up, we will be on location at O O Alpan LLC in Fairfax, Virginia, discussing the latest advances in allergy care and treatment and how they can help treat and manage the various types of allergies that so many people suffer from with one of this region's top allergists and immunologists, Dr. O O Alpan, along with the nurse practitioner here at O O Alpan, Laura Noonan. Welcome, Dr. Alpan. It's a pleasure having you on our program.
Thank you for having me.
Now, we understand we're going to be interviewing Laura, who's a nurse practitioner here at O O Alpan momentarily, but I just wanted to have you on quickly to tell us about, in some detail, about the O O Alpan division, which encompasses allergies and immunologies, things along those lines.
So at O O Alpan, I think we're a very unique practice in the sense of not only providing patients for their care of their allergies and immunological disorders, but we have excelled ourselves in certain areas in our field, which is the field of asthma. Okay. The other one is food allergies, and finally patients with immunological disorders. We are probably one of the few centers in the United States that provide an end-to-end care to such patients, ranging from their diagnosis, treatment, for their laboratory needs, as well as providing clinical trial options for some patients who have the more severe form of these disorders.
Very interesting. You're one of the leaders in the country.
Correct, and we also published in the areas of our interest.
You and your practice, O O Alpan LLC here in Fairfax, Virginia, have certainly established a reputation as a leader and for excellence in not only allergy care, but immunology specialties as well as patient care. And I just wanted to ask you, Doctor, if I may, if you can please tell us what you feel helped separate you and your practice from many of the others.
So let me categorize them in two different big categories. One of them is in an educational perspective. Here at O O Alpan, we play a very important role in the education of medical students that rotate through us from Virginia Commonwealth University, as well as pediatric and family medicine residents that rotate through our practice from places such as Fairfax Hospital, Georgetown University. So I think we play a very important role in the education of young physicians. The second is we have excelled in certain areas, not just locally but nationally. One of them is diagnostic immunology. This is understanding what's wrong with your immune system. And we have one of the few labs in the country that has the capability of do so. And the second and more interesting one to us is the care of patients with asthma and food allergies. We have provided end-to-end care to such patients, not just in their diagnosis and management, but also providing them clinical trial options that they cannot get elsewhere.
Yes, indeed, you're certainly a leader in your field, and you're helping so many folks each and every day. And on that note, I'd like to thank you, Doctor, for joining us and being a guest on our program.
Thank you very much.
It was our pleasure. Welcome, Laura. It's a pleasure to have you on our program.
Yeah, thank you for having me.
We appreciate you coming on, and I wanted to begin by asking you as well, Laura, if you can please tell us about how common some of these allergies and asthma are that affect so many people.
They're extraordinarily common. Allergies and asthma are among the most chronic conditions worldwide, and there are probably about 50 million Americans that suffer from these.
Oh my God, I knew it was a very high number. I didn't know it was quite that high.
Very high.
And what would you say are the main causes of these problems?
There are multiple different types of causes, as there are multiple different types of allergies. There are environmental allergies, which can be tree pollens, grasses, dust mites, pet dander. There are also food allergens. People who have for example, peanut allergies. People have medication allergies. So multiple different forms of allergy.
Yes, and would you say there's an increased risk due to family history when it comes to these?
Yes, there definitely is some increased risk with family history. It's a major risk factor for developing allergies. We're not really able to always predict who will get them, but we do know it's a risk factor.
And for the folks out there watching, Laura, who would you say, based on all your experience and history here at O O Alpan, would be a good candidate that can benefit from the treatments you offer?
I would say really anyone who has any type of allergy symptoms would definitely benefit from a workup from an allergist's office. Okay. You know, seasonal allergy symptoms, runny nose, nasal congestion, itchy eyes. You know, also food allergy symptoms, you know, they can range from rashes to, you know, the full-blown anaphylaxis with swelling, difficulty breathing, as well as, you know, asthma, which is lots of chronic coughing, shortness of breath, and wheezing.
Yes, so quite a few folks out
Yeah.
there. And what types of symptoms should we look for?
So with seasonal allergies, you're going to see, you know, a lot of nasal congestion, runny nose, itchy eyes. Some people also get eczema, also called atopic dermatitis, which is some dry, itchy skin. That's what you can see from environmental allergies. Food allergies, you can see a wide variety of symptoms from, you know, hives, rashes, swelling, abdominal pain, you know, trouble breathing.
How would you treat for these problems to make the proper diagnosis so you know which treatment to offer?
Mm-hmm. So with food allergies, the best treatment is avoidance. You know, once we discover, you know, through testing that you do have these allergies, there's no real way to, you know, treat it so it goes away, although some children will grow out of these allergies just with time. So we just recommend avoidance and monitoring of food allergies for over a period of time. Seasonal allergies, you know, we can do a workup of different allergy testing and determine which is the best treatment for that, whether it's medication or immunotherapy, which are allergy shots.
Oh, very interesting. And can these allergies be prevented, Laura?
Allergies not necessarily can be prevented. There's no evidence out there saying, you know, with foods, the longer you avoid something will prevent you from having the allergy. It's more, our practice is focused on finding what you are allergic to and helping you out with it from there.
And what would you say are some of the most effective treatment options for these allergies and problems that you've talked about that can help folks out there?
There are multiple different types of medications which can be more, you know, immediate alleviation of symptoms. And then also the immunotherapy allergy shots can be very effective. It's more of a long-term treatment, training your body not to respond so harshly to allergens when it comes in contact with, and that's for the environmental allergens like tree pollens or pet dander, dust mites.
You know, a lot of us get affected by some of those.
Yes.
Now, what types of results can we expect from these treatments?
The results from medications are fairly good. You know, more immediate relief, just kind of with those, you know, runny nose, itchy eyes type symptoms, but the immunotherapy generally works very well for a long-term treatment. You know, you've trained your body not to respond and give those symptoms over time.
And on the immunotherapy, which is obviously separate from the medication side of treatments,
yes.
What is someone looking at as far as, do they have to come back periodically for additional visits, or a little bit more about what's involved, yes, so we have a better understanding?
Sure. Allergy shots definitely are a big commitment, but the outcome can be very good. The average time on shots is 3 to 5 years. So that's where you get the big time and commitment. You have to start out coming weekly for your injections, but you're building up to a maintenance dose. That usually takes about 6 to 9 months, and once you reach that, then your shots will be stretched out a little further in between, about monthly.
Oh, okay. Well, that's certainly good to
Yeah.
know. And are the results permanent after some of this has taken place?
For some people, they do seem
Yes.
to be permanent. Not everybody. You know, there's variation, you know, person to person. But a lot of people, you know, we have seen very good long-term results with it,
Well,
leading less medication after shots.
All right. Well, that was certainly a very interesting interview. You certainly educated us on some very important areas, namely on allergies and immunology and how it can help so many of us. And on that note, we'd like to thank you, Laura, for joining us and being a guest on our program.
Thanks for having me.
It was our pleasure.